Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. We are continuing our conversation about the joys of that new baby in your house. We're talking with Dr. Ryan Cicenas about bringing the baby home and about that initial first immunization visit. What can parents expect? It can be sort of a stressful time. No one wants their little one to be hurting. So what can they prepare for?
Well, first and foremost is in knowing that we are protecting the baby. As a parent, as a pediatrician, we go through with others that we're protecting them against diseases, against some of the more common types of bacteria and viruses that can affect their baby, knowing that it is a good thing in the long run. Now, what can you do to prepare? Just be aware that they are going to have, usually at the first visit first immunization visit is at 2 months of age, and but you'll have a few visits beforehand to kind of prepare and talk with your pediatrician or your primary care provider about what's coming. Most babies will get 3 shots, 3 vaccinations in the leg, 2 in one leg and 1 in the other, and they'll get an oral vaccination. So they get 4 total vaccinations at that first 2-month visit, and just to be aware that that can happen. When I first started doing this, we actually recommended giving Tylenol beforehand to premedicate the babies to try to prevent a fever or any side effects. But we've learned through studies that that is not good for the baby. We do not recommend giving anything beforehand because it can blunt the response from the vaccinations that we want. We want to see antibody response. We want to see these babies be protected against these diseases, and by giving something like Tylenol or acetaminophen, we don't see quite the response.
Interesting, because that is exactly opposite, like you said, of how I brought mine in. We always would try to predose. Yes. So again, don't predose. Let that immunization
Absolutely.
kind of get the full effect. Is there any guidance on, since babies are probably going to maybe not feel terrific after this visit, should you do it on the closer to the weekend? Is there any guidance on that? I know some parents maybe try to hit a Friday so they have the weekend to recover.
Some parents do. The vast majority of babies don't have any problems with vaccination. Up to 30% of babies will get a fever. It can be as high as 101, 102 over the next 12 to 24 hours, sometimes even up to 48 hours after a vaccination. Some babies can get a rash or a little bit of redness around the area of the shots. Some babies may get knots in the area of the shots. The other thing from the oral vaccination, the rotavirus vaccination, some babies can have a little bit of loose stool over the next week, maybe some more spitting up. But the vast majority of babies don't have those side effects. The things that you can expect afterward, they're going to be a little bit fussy immediately afterward. So I do recommend parents either swaddling them, holding them, rocking them, just in the office. If the babies are breastfed, I recommend the baby going to the breast afterward. It can help calm them down, or bring a bottle with babies who are bottle fed, and to feed them right afterward often will calm them down. As far as going home, again, if it's just mild symptoms, there's nothing other than comfort for the baby. If they do have that fever or much more fussy than normal, you can do a small dose of acetaminophen afterward.
Aside from the immunizations, there are other things that are accomplished during the initial visit. What else can parents expect as weight and measurements kind of thing?
Absolutely. Our job as pediatricians or primary care providers is to make sure the baby is growing well. What are they eating? We're going to be talking about which formula they're on, how much and how often they're getting. If they're breastfeeding, how often, how long in each breast. Breastfed babies also need to have supplementation with vitamin D at that age. Are they getting that? So we look at the weight. We look at the weight on a growth chart. So by this 2-month visit that does have the immunizations, we're tracking how well they're growing from birth up until that point. And if there's a problem, we address it, and we have a plan to fix that. We look at development. Is the baby developing well? We look at the gross motor and fine motor. So we're looking to see if the baby is when they're on tummy time, if they can lift their head up. Are they bringing hands to the midline or past midline? Are they following now? And at 2 months of age, most babies are smiling. That's an awesome time.
Oh, it's so precious.
Awesome time. Or when they're cooing, making that sound that adults can't replicate. It is absolutely adorable. But those are the things that babies will do developmentally, and we're looking for that. We're also looking, how are they sleeping? And how are parents doing? It's not just about the baby, it is about the family. It is a tough time because of the sleep patterns of babies aren't quite what they're going to be later on, and so we want to know how the parents are doing, how mother is doing. Is there any postpartum depression? Is there something that needs to be addressed? And we need to get help for the mother for that.
Yeah, there's a lot of things to consider, and you really cannot underestimate that disrupted sleep, and there are a lot of things that can kind of cascade from that. So a great conversation to have with the parents. I love that.
Yes.
Dr. Cicenas, thank you so much. Such a wonderful time for these families, a lot to consider as they grow their families. Thank you. Thanks for being here for Valley Health Minutes. We'll see you next Monday.